Good afternoon, everybody, and happy Monday. Thank you for joining us again for this Eau Claire County update on COVID-19. We are here to share what's happening in our community as well as statewide and to answer questions that people have. We're pleased that people are taking an opportunity to get information that makes a difference in their lives, and we know that this has been tough. So just to say again to all of you that it's difficult and this is a challenging situation, not only for us because of the safer at home order, but also because people are getting sick and people are dying across our state, and that's hard for all of us. So today, many of you know that Governor Evers did announced just a little bit ago to have an executive order to delay in-person voting in our state. We will be talking a bit more about that. The governor's executive order does delay in-person voting until June the 9th. Done for public health reasons, for important public health reasons for a statewide vote. We are awaiting a possible Supreme Court discussion of this item. We haven't heard yet that has been brought to our Wisconsin Supreme Court, but we do know that the leadership of our legislature has indicated that they are likely to do that. So we are waiting to hear what that outcome is as well. Do know that public health officials across the state this weekend on Saturday spent a considerable amount of time crafting an opinion and providing data to the governor as well as the legislature in advance of their 4 o'clock time on Saturday in order to give the public health science and perspective for why an in-person vote on tomorrow, on Tuesday, would not be in the best interest of the health of the public across the state. And I can certainly talk a bit more about that work that was done and why it was done. It is rapidly changing, and certainly everything about COVID-19 has been rapidly changing. This election is one example of that. The safer at home order, though, is our best way to decrease the spread of disease and flatten the curve. And really our public health approach to this disease is to use our strategy of physical distance and small circle, that's safer at home order, in order to decrease the number of people that get ill. Today we will have Carrie Riepel again sharing with us a bit of a voting update until we hear a final announcement about the plan for voting in person tomorrow. We are continuing with our plans for in-person voting in a safe way in Eau Claire County, and Carrie is here to give an update on that as well. So a status update in Wisconsin announced today 2,440 positive cases by testing for COVID-19. That's an increase of over 1,400 cases. An increase of 100 cases, a little more over 100 cases, I believe, and 77 deaths, an increase of 9 deaths since Friday when we last reported. More than 26,000 negative tests. The hospitalization is reported at the state level of 668 people, about 27% of the total cases of COVID-19 hospitalized. Again, in this state, we are prioritizing those people that are tested, so it is not a surprise that a little over a quarter of the tested cases are ones that are hospitalized. There are 12 testing sites in Wisconsin, not including those commercial labs nationally, with a capacity of over 3,500 tests per day. And the state is considered a community spread state, broadly defined by the state health department. The state physician today did talk about the fact that there are likely 5 to 10 times the number of positive COVID-19 cases beyond what has been tested. So we know that many people are not symptomatic, many people are not getting tested because of minor symptoms, and the estimate that the state right now has is 5 to 10 times the number of positives is what we could assume potentially are positives in our state. So the positive tested cases versus the total positives. In Eau Claire County, we now have 21 confirmed cases of COVID-19. That's an increase of 5 since Friday. Our testing numbers are at 952 tested with 845 negative. Only 86 remain as pending tests. So our number of pending tests has gone down significantly, likely a connection to the fact that we have a number of local efforts happening related to testing and an increase in testing capacity across the state. Again, our youngest positive cases are in their teens, and our oldest are in their 60s. Our case follow-up does continue for every case that we have. So for all 21 of those cases, we contact the case and do a very in-depth review with that case from the point of time they began with symptoms, going back from that point and looking at anybody that they have come in contact with that is considered a close contact. All of those close contacts that are identified during that interview process then are contacted, and they are told to self-quarantine for 14 days from the point of contact until and monitor their symptoms during that time. So that contact investigation does continue in Eau Claire, and we anticipate continuing to do that. Certainly there are some parts of the nation where contact investigation just simply is not possible given resources, but in our state, in Wisconsin, contact investigation does continue to happen and is a really critical part of our public health follow-up and control of this disease. The smaller the circle, again, the easier that contact investigation is. So the more people that someone's come in contact with, the more likely we have community spread of disease. We also want to just note that there is on the state website, and there has been some discussion about commenting about recovered cases. The data on recovered cases is not very good at this point in time, so we are currently not reporting on recovered cases, and on the state website they're also not having a lot of information about that as well. As soon as we get better data, I'm certain that that will also be reported. The call center this weekend got over 30 phone calls. We had limited hours, but we continue to have the call center in operation. An average of about 45 calls a day, a high of 82 calls last week. Lower volume on the weekend. There are currently over 80 volunteers that and staff that work at that site. So we have both health department staff and other staff, as well as volunteers that have been willing to work with us to be at that call center. And they sit for different shifts using a script and talking to people individually. The majority of questions are often about symptoms and about the Safer at Home order and what businesses are essential. So it's an important capacity that we have locally, and we're really pleased that we have volunteers and the staff there that are able to answer those questions. Sometimes those people do get a really nice thank you for doing this work, and thank you for having a real person to ask a question of. So we also appreciate the call center individuals getting that kind of thank you. Nationally, over the weekend, the CDC did release a recommendation for individuals to consider using a homemade face cloth or a cloth face mask. That CDC recommendation is on their website, and there's some pretty extensive information about that. About an hour ago, we found the state did indicate that they have also put on their state site a matching amount of material related to using homemade masks or homemade face cloths for individual use. We will be adding those links to our website, our health department website, again, coronavirus.ecehealthdepartment.org. It's really important for people in Eau Claire to understand that physical distance is our most important prevention measure. Homemade face cloths might make people feel more secure, but the purpose of a homemade face cloth, if people choose to use it, is to protect others from your coughs and sneezes, not to protect you from getting the disease. What protects you from getting the disease is maintaining distance. So really important for people to understand that. Those homemade cloths, there's directions for use. They should really not be considered to be used if you're in your own household, unless you're trying to protect someone in your household because you're concerned about potentially having the disease, even if you're not showing symptoms. And even if you're out, I did not wear a face cloth out when I was walking the dog. When I'm not going to have contact with anybody that is closer than 6 feet, people should really think twice about wearing those face cloths. It does cause impact to people's ability to easily breathe, and they can be irritating enough that people constantly then touch their face. Constantly touching your face is one of the risk factors for getting a disease like COVID-19. We don't want people to be doing that. We also want to make sure that we're reserving surgical masks and other masks for our most at-risk population, for those very close encounters with sick individuals. And those are healthcare workers and first responders. So again, a reminder about why that is so important. We have gotten a number of questions because this happens to be us entering into, for some, a religious tradition called Holy Week or Passover. This week, accumulating on Sunday, which is Easter for many people that celebrate that as a family or celebrate that within their faith traditions, is a time when people often get together. A critically important time and critically difficult with the safer at-home orders that are in place. Physical distance remains our best protection. Our communication to our faith leaders in Eau Claire is to continue to do those creative things that they've been doing to get messages out to their congregations, but to not in any way, shape, or form encourage people to be at risk by being closer in proximity together. Stay at home. Find ways to link with your family, find ways to link with your religious leaders and people that you connect with if that is an important faith tradition for you. And we're really asking our faith leaders to work with us in those cases where they're trying to find creative ways and they want to make sure that they are protecting their members in the best way possible. We do recommend streaming of services. We do recommend family units doing Easter traditions, both religious and household traditions. We do not recommend neighborhood egg hunts. We do not recommend any of the methods that would be in violation of the order. So please pay attention to that. We know it's hard. And we know those traditions are important, but please pay attention to the fact that these physical distancing is our best way to decrease the disease in Eau Claire County. I would also then say to you that driving anywhere is for essential reasons. The essential list is in the order. That does include driving somewhere to walk at a park or driving somewhere to have your family unit be outside. But it doesn't include gathering a large group in your family to do a social outing at a local retail outlet so that you can all get out of the house and have some social time at that retail outlet. Going to a store, going to an essential business should be the fewest number of people for the shortest number of time for the most essential things that you need. That is what the order is written for. We do know people are challenged by staying at home. Again, our request is to go out for those essential services that you may need to do with the fewest number of people for the shortest amount of time, and for those things that you most essentially need is our request. So I'm going to now turn it over to Carrie to share with you some thoughts about the election, and then I'll be back to close out and answer questions. Thank you.
I am Carrie Reeple, the Eau Claire City Clerk. The status of tomorrow's election continues to change due to potential litigation and legislation. We recognize that this is probably not the last change. The governor did issue an executive order today moving the April 7th election to June 9th. However, that has already been appealed by the Wisconsin legislature. Therefore, we have taken it upon the recommendation of the Wisconsin Elections Commission to continue preparing for an in-person election tomorrow. We will update the community if that should change. At this point, if the April 7th election is not held tomorrow and it is postponed, absentee ballot requests and the submittal of the ballots back to the clerks will be dependent upon the new date. The June 9th date may change also because the legislature is going to meet tomorrow and they have the option of choosing a different date upon the approval of the governor. So, like I said, everything continues to change, but we are doing everything in our ability to keep the public updated on those changes, and we are continuing with our safety protocols and our procedures to make the in-person voting, if it happens tomorrow, as safe as possible for both the voters and our poll workers. It is a lot of legal changes, and we recognize that the voters, it's a difficult situation for the voters as well, but we are trying to keep everybody as up to date as possible.
Thanks, Carrie. It is a challenging situation. We know that voters are watching this and want to know, and we will certainly get information out as quickly as we can. The governor's order did ask, as Carrie said, for the legislature to convene at 2 p.m. tomorrow for a special session. That special session, depending on what happens at that, there may be additional information available to all of us tomorrow at this point in time. We do have a video available that we will append to this, to our Facebook link for this session today. That is how to vote safely, and that video will be available widely if you have not seen it. The team in Eau Claire has done just a yeoman's job putting together not only information for voters and for poll workers on how to create an environment that can be safe for this election following public health principles, but also a lot of work has happened to go out to all the poll sites to make sure that they are set up in ways that are acceptable. That's happening today as we speak, just in case we have an in-person election tomorrow. Do know that the poll worker safety and voter safety is of utmost concern to me as the health department director and incident commander, and to the team across this community that's been working very, very hard on this. So if in-person election happens tomorrow, do know in Eau Claire County, please vote and know that every vote counts and we need you to do that. So I will open it up to questions right now, and certainly between Carrie and I, depending on what the content is, we'll provide a response to that. Any questions? Yes.
Do you agree with the governor's order this morning? He's saying it's not going to be safe to have a first election. Do you agree with that decision? Do you think it's the right decision?
So the question was, do I agree with the decision of the governor to do an executive order to delay the election? I do agree that for a statewide election, we needed to delay it. I also believe that we worked hard in Eau Claire, and we have an environment here and the lack of widespread community spread of disease here that we would have been able to have a safe election tomorrow. I did sign on to a statewide letter on Saturday saying that we encouraged, as public health officials across the state, the governor to move the date to June. And the science is showing us that there are places in the state where a safe election can't happen given the current spread of disease. And this is a statewide election, so we can't do this municipality by municipality. We need to have a statewide response. So the governor moving the election was the responsible thing to do. It follows public health principles and is the right approach given our current situation. Obviously, unprecedented, but is the right public health approach. Any other questions? Yes.
Either you or Gary can comment on this. In regards to poll workers, where does the county sit? Are we still sitting fine if the election does go on tomorrow, as I guess is planned at this point in time? Is there enough poll workers to account for everyone?
Yes, we have worked hard the last stretch, but certainly the last week, to determine numbers of poll workers, and the clerks have done a yeoman's job to make sure that we have poll workers available in every poll site across the county.
Do you know what the numbers are compared, like when Carrie and I talked a couple of weeks ago, it was about half of normal. Is that better now? You guys have more, and also the numbers of voters aren't expected to be as much, so is that not a huge concern?
Yeah, so the follow-up question was related to, are we concerned about the number of poll workers and the people we have available? Again, across the county, we have sufficient poll workers to run all the poll sites at this point. We do have additional assets coming in, people that are available if we need them tomorrow. And while some of the numbers were down initially, Carrie and other clerks across the county have worked extremely hard to not only find additional people and train them, but make sure that their settings are very, very safe. So across the county, again, we have more than 30 polling sites across the county, including the ones in Eau Claire, in the city of Eau Claire. All of those have poll workers available. Yeah.
If the governor's order stays and it's moved to June, and we come up on June and things still are not where they want them to be for the safety of everyone, I guess, is there a point of no return? Like, what's the latest that they can push us back and still hold the November election when it's scheduled at this point?
So the question was really about what is the latest point in time an election can be held, and I'll defer to Carrie if she has a date for what is connected to the November election. We do know that moving the election to June is really looking at our data and saying, what do we think is going to happen with the COVID-19 pandemic? And the determination by public health officials across the state, as well as the governor's office, was that June is a safer point in time to look at an election happening. We don't know exactly what will happen. June, it was calculated based on people staying at home, frankly, with the safer at home order, and in the next 2.5 weeks of the order being in place, really flattening that curve out so that we don't have widespread transmission and we have an ability to have poll sites that are safe across the entire state. Carrie, do you know? Yeah. So the date, I think that's probably a state level question for our about what date would be the latest we could do an election in order to be ready for the presidential election in November. So I don't have that information, but certainly I'm certain that's something that will continue to be talked about. The June date may or may not be the date, as Carrie said, for the Wisconsin election. It is in the legislature's hands now to determine if they would like a different date than that, and that would be the legislature and then the governor approving a different date if they so determine that that is what is of interest. Yes.
I'm kind of curious why Clerk County seems like it's very kind of slow but steadily, increasing of cases. And I know you can't tell us a whole lot about who these cases are, but I'm wondering if you can speak to if any of them are, family units or a chunk of cases that are in one specific, situation of mass living, like nursing home or something. Can you speak to, if any of our cases are, a big chunk of one?
Sure. So the question is, we've seen kind of a fairly slow progression of increased cases across Eau Claire County. Can we share anything about what makes up those cases related to? Is it a big group coming from a certain site? Is it a certain population that we're seeing? Our cases, our 21 cases, are really dispersed across the county. There are some places, like Fond du Lac announced today, a nursing home outbreak that was significant with a number of cases. We do not have that dynamic currently in Eau Claire, and we're certainly working hard to prevent that, but it is a risk. Most of our cases are travel related, and then some people that are connected to other cases. So again, our cases are widely distributed and occasionally in family units. Any other questions today? Again, thank you for being here. We likely will have some significant updates again tomorrow related to the election at least, and we will share those. We do know that this is a changing situation, which is hard on everyone. We do hope you take a break occasionally from the media, even though we love the media that is here today. Put your phones down, put your devices down, and take a deep breath and take a walk around the block if you're able to do that. Also know that today is the start of Public Health Week. It's a week that we take every April, the first week of April, to say, yeah, public health makes a difference. Prevention is what we want to do rather than always treating people that have significant health problems. And that's the work of public health. So if you see a public health person, please tell them thank you for what they're doing. In unprecedented times like this, we need public health workers. Many people may not realize that Wisconsin, as a state, has local and state public health workers in government. And we have a state that is very, very unfunded for public health work at the both federal and state level. So those people are doing their jobs in ways that are amazing every day. I thank my public health team in Eau Claire. They are a group that every day puts forward an amazing effort to protect and promote health in this community. So my thanks to them, and I hope you find a chance to thank someone in your circle that is working in public health. Please know that the COVID website is regularly being updated for the health department. And if you have questions that are not answered there, please call the call center number. Again, that number is 715-831-7425. Please stay safe and make sure that you're protecting those around you. Thank you.